I'm Dr. Arielle Garfinkel, owner of the Smile Garden of East Windsor in Windsor, Colorado. And when I'm talking to patients about what their dental options are, I like to also talk about their overall health and how it's affecting the rest of their mouth. When I see a patient with a lot of cavities or with periodontal disease, I'm going to ask them questions about their sleep habits, their digestion habits, if they're taking any supplements, their nutrition and diet, because it all affects the body and how our teeth respond and our acting as a result of our overall health. Diet and sleep can have big effects on our dental health because if someone is not sleeping well and they're snoring a lot, then they're going to usually have their mouth open while they sleep, which can dry their mouth out and make it a more favorable environment for bacteria to grow and cavities to develop. Same thing with nutrition. If people are eating a lot of sugar and snacks, drinking a lot of soda or coffee throughout the day, then it doesn't give the saliva a chance to neutralize the acid in the mouth and create a favorable environment for the bacteria to not be able to grow. Bacteria love an acidic environment, and the saliva does a great job of neutralizing that acid and preventing the bacteria from growing. Gum health is really important for keeping implants stable because when people have a lot of inflammation in their gums, that's bacteria and the immune system creating a response in people's mouths that is unfavorable for the stability of an implant. Implants rely on healthy bone and healthy gums. And if there's bad bacteria and immune responses attacking those foundations, then the implant is not going to do well long term. Oral health and our overall health are greatly connected. We are finding more and more that the bad bacteria in our mouth doesn't just stay there. It travels through our bloodstream, it's swallowed and goes down our digestive tracts. And research is showing that those bad bacteria are actually found in plaques in the heart with heart disease. And it's also shown in the gut, and it can affect your digestion, your heart health. It increases your risk of Alzheimer's disease also. And so when we talk about gum health at the Smile Garden, we make sure people understand the risks that come with having unhealthy mouths and gums that are not doing well. So before implant surgery, patients can work on their oral health habits. So they can work on their brushing, they can work on their flossing, they can come in regularly for their cleanings. We want to make sure that their gums are healthy. They also should be eating a healthy diet. Maybe we talk about supplementation to make sure they're not nutritionally deficient, but we want to make sure that people are healthy overall so that they can have the best long-term success with their implants. Our team at the Smile Garden helps patients with their implant care by providing implant cleanings involved with the rest of their mouth, or if it's denture supported, we can talk about removing the dentures and cleaning the implants, but we make sure we encourage good, healthy dental habits so that we're able to maintain the implants long term. What sets the Smile Garden apart from implant care is that we are talking about how your overall health affects the health of your implants and the stability long term. So we want to make sure that people are sleeping well, digesting well, eating well, because if your body is not doing well, then it is more likely that your implants will not last long term. And we want to make sure that people get the best results and are able to keep their implants forever, as long as possible. But a lot of that takes work to stay healthy and keeping your implants clean. So the best way for someone to begin with their implants and a whole health approach is visiting us at the Smile Garden, and we can start that conversation. We can start figuring out where we are having issues, if we're having issues with diet or sleep or digestion, and start directing you to the right places to get those things under better control so that you can have the best implant outcomes.